As one of my patients so eloquently stated, irritable bowel syndrome sucks. And you know, she's right. The symptoms of irritable bowel syndrome, diarrhea, constipation, abdominal pain, bloating, flatulence, are very unpleasant. And there's no question that patients are certain something serious must be going on if I feel so bad. We don't understand the causes of irritable bowel syndrome. We do understand that individuals with a history for adverse childhood experiences are more likely to have irritable bowel syndrome than those who have not. Those who have had emotional abuse, physical abuse, sexual abuse, financial abuse as a child are more likely to have irritable bowel syndrome. We also know there's a connection between anxiety and depression and irritable bowel syndrome. They sort of go hand in hand. If you have irritable bowel syndrome, you likely also have a diagnosis for anxiety and depression. And then certain food intolerances are unique in and of themselves and will cause the symptoms. But again, there is no clear understanding of what the cause of irritable bowel syndrome is. That said, making a diagnosis and ruling out serious disorders is important. Blood tests to look at the liver functions, the kidney functions, and electrolytes and thyroid functions and so forth are important. A stool specimen for blood, a stool specimen for certain bacteria or germs which might cause irritable bowel syndrome symptoms is in order. And a referral to a gastroenterologist is not uncommon. The gastroenterologist may want to do a colonoscopy, may want to do an endoscopy to rule out the more serious cause of those symptoms. Cancer, intestinal disorders like Crohn's disease and ulcerative colitis, a peptic ulcer, GERD, and the like will all be something that would be addressed by a gastroenterologist to rule out those causes for the symptoms of irritable bowel syndrome. But once we get the diagnosis clarified and we're confident that it's irritable bowel syndrome, it's time for treatment. And treatment starts with cognitive behavioral therapy or counseling. We know that what goes on in the brain has a very great effect on our intestines. So that behavioral cognitive therapy, counseling, is a critical first step. Then we look at the foods that we eat that may cause the symptoms. We're looking at gluten foods, the breads and the cereals. We're looking at dairy products like lactose. The new category is called FODMAPs, fermentable carbohydrates. And these are fruits and vegetables and grains that actually go through a fermentation process in the gut and may cause the symptoms of irritable bowel syndrome, the bloating, the flatulence, and so on and so forth. Once those are done, there are medications which we can use to treat irritable bowel syndrome. For the abdominal pain and the bloating, an old medication called Bentyl works pretty nicely. For those individuals with diarrhea-associated irritable bowel syndrome, medications like loperamide and Viberzi are effective. Viberzi is a newer medicine that's been on the market just a fairly short while. For those with constipation-associated irritable bowel syndrome, we use medications like Miralax, and then there's also some newer medications, Amitiza and Linezess, have been used to effectively treat patients with constipation-dependent irritable bowel syndrome. Recent studies have also pointed out that probiotics and digestive enzymes may benefit patients and their symptoms of irritable bowel syndrome. Be Healthy, Be Happy is proud to announce Be Healthy, Be Happy Digestive Health Pro Probiotics plus enzymes. This is formulated specifically for individuals with digestive disorders consistent with irritable bowel syndrome. It's a fantastic, unique, proprietary product, and it works and helps the symptoms quite remarkably. This is Dr. Jim for Be Healthy, Be Happy. Power your path to happiness, and be sure to subscribe to Be Healthy, Be Happy with Dr. Jim.